My name is Avishai. I'm a registered nurse, a student at University of Wellington. So I'm presenting to you gambling addiction as my assignment today. So what is gambling? According to the American Psychiatric Association, gambling is a disorder that is characterized by persistent and recurrent problematic gambling behavior that lead to clinically significant impairment or distress. So if you bet and it leads to distress and impairment, that is gambling. That's when it's in excess. So how many people gamble? The National Council of Gambling estimates that approximately 5 million Americans meet the criteria for compulsive gambling. So like 5 million people do gamble in America, but only like 8% of these individuals will ever seek for help with their problem. Men tend to have higher rates of gambling participation and are more likely to develop gambling disorder compared to women. And age-wise, it's mostly the young adults that gamble most. So what are the characteristics that present with gambling addiction? First, we see physical characteristics, and we talk about the psychological response. Individuals with gambling addiction may experience heightened arousal, such as increased heart rate, sweating, and restlessness during gambling session because they're gambling and hoping to win, and they are just nervous. We have the neurological response, which is the release of dopamine during gambling to reinforce addictive behavior, just like it is with substance use when dopamine is released because substance is being consumed. And we see that it's the same with gambling, a behavioral addiction. We have also the psychological response. There's a loss of control. Despite negative consequences, individuals struggle to control or stop their gambling behavior, leading to a sense of powerlessness. There's that loss of control. There's also the behavioral response. These are characteristics of gambling. There's also the behavioral response that is escalating gambling. So individuals with gambling addiction engage in gambling more frequently and for longer durations, often increasing the amount of money that the bet, that's like tolerance, increased. So what do we do to diagnose gambling addiction? According to the American Psychiatric Association, for an individual to be diagnosed with gambling addiction, they will demonstrate persistent and recurrent problematic gambling behavior, leading to clinically significant impairment or distress as indicated by the presence of at least four of the following criteria. So there are 9 criteria actually, and there will be at least 4 that this individual will demonstrate persistent, recurrent, problematic gambling behavior toward that within a period of 1 year, 12 months. So the first one is that they will develop tolerance. That's the need to gamble with increasing amount of money to achieve their desired excitement. There is a development of restlessness and irritable, attempting to cut down or stop gambling. That's like a sign of withdrawal. And also the loss a lot of money after returning another day to get even more money. So they are always chasing money, but they keep losing because they're trying to chase their loss down. So we also see that this individual has made repeated unsuccessful effort to control or cut back or stop gambling, but they are not able to do that. That is a criteria that if they fall under and do more, they will classify as gambling addict. So there's also the challenge of often preoccupied with gambling. They're either thinking about the past gambling, or they're thinking about the future one, or they're in the midst of gambling. All their life is all about gambling. And also they also gamble when feeling distressed. When they are in guilt, anxious, depressed, or helpless, they will gamble. They lie to conceal extent of involvement with gambling. They tell lies. They are ashamed to tell their family and loved ones and friends that, oh, they have gambled, they have lost this ton of money. They will lie. They will tell lies. They jeopardize or lose a significant relationship, job, or educational or career opportunity because of gambling. When one of these occur, that puts them at the risk of being diagnosed with gambling addiction. And lastly, they turn to rely on others to provide money to relieve desperate financial situations that they could have done it, but because of gambling, they tend to not be able to cover their expenses, and they want somebody to do that. So they're always desperate. So any four of these points, we categorize them to be diagnosed with gambling disorder or addictive gambling. There are comorbidities or side effects that comes along with gambling, and the first one is substance use disorder. According to Cowley Shaw, individuals with gambling addiction often have higher rates of substance use disorder, such as alcohol or drug abuse or substance. There's co-occurrence of gambling disorder and substance use disorder that can have a compounding effect on negative consequences and treatment. So it's very difficult to treat somebody that has multiple comorbidities added to gambling disorder. So they have that impulse control disorder. Like the gamble, they share similarities with other impulse control disorders such as kleptomania and compulsivity shopping. Individuals with gambling addiction may also exhibit symptoms of other impulsive behavior like ADHD. So the etiology of gambling addiction. What is the underlying cause and factors contributing to gambling addiction? It is complicated and multifaceted. It's not just one. It is definitely a combination of multiple factors. And the first one is the biological factor. Genetic factors reveal that there is a hereditary component to gambling addiction. A gambler most likely comes from a family that is gambling, or the uncle is gambling, or the auntie is gambling. Someone is gambling in that family. That is how they came about with gambling. There's also the psychological factor. The psychological factor reveals the personality trait of the individual. So certain personality traits such as impulsivity, sensation seeking, and competitiveness have been associated with an increased risk of gambling addiction. What I want to point out is the competitiveness. You see, people will want to gamble just because they want to meet up with a friend or lifestyle of a friend, but they are not able to return to gamble. They want quick money, instant gratification that pushes them to go gamble. We also have environmental factor. An environmental factor is talking about the availability of gambling opportunities. In America, we know of Las Vegas. Las Vegas has a ton of machines, ton of gambling facilities that you just get to click and you go in there. So individuals that are around those casinos, online gambling platforms, and are exposed to adverts, like you are watching your screen and an advert come up with gambling advert, and you click, and the next thing they're pulling you away. So stuff like that are the beginning and the original cause of gambling. Social determinants of health that affects the etiology of gambling. So there's also the social determinants of health that affect the etiology of gambling. And the first one, we talk about low socioeconomic status. It is associated with a higher risk of gambling problem. Yep, places that they have low level of economic growth tend to be associated with higher risk of gambling. Individuals from disadvantageous socioeconomic background may face financial stress, limited education opportunities, and higher exposure to gambling facilities, and that will be a cause for them to go into gambling. Cultural norms. Some societies see it normal to gamble. Yeah, so there's a societal attitude toward gambling that influences the prevalence and acceptance of gambling behavior. So in society where gambling is prevalent and socially accepted, individuals may be more likely to engage in gambling and experience gambling related problems. There's also the accessibility of gambling facilities that I mentioned, like the casinos. So, treatment for gambling. How is gambling treated? There is the psychotherapy, like the cognitive behavioral therapy and motivational intervention, that helps in treatment of gambling. The treatment of gambling involves a combination of all of therapy, social group, and medications to get treatment. Our about support group like Gamblers Anonymous provide a supportive environment for sharing experiences and discussing challenges, then ways of abstaining. So medication also, which the most common use are the selective serotonin reuptake inhibitor and the naltrexone. And there's the need for financial counseling. Individuals that gamble don't know how to manage their finances, so if they could get some counseling on how to manage their finances, it could go a long way to help them. So with all this, they'll be able to get themselves treated. They will abstain from gambling. And I have come to the end of my presentation. I have been Elvis, and thank you for watching.